Hello colleagues, this is Mr. Coco and welcome to my class. So this evening I would like to continue with IMCI. So we are on symptom number 4. We call them main symptoms or the problems that affect children. So this problem is an ear problem. So the question is that does the child have an ear problem? So that's what we want to look at. So if you want to know more about IMCI, go to the first session which we had. That is number 1 and introduction. So you find that it follows just like that. So you'll be able to understand well what we mean by the main symptoms, what we mean by general danger signs, and that will help you understand very well. So let's go on number 4. We see what it is. Okay, so number 1, we are looking at asking questions, and the questions that we would like to ask are that does the child have an ear problem? So that's the first question you need to ask when the child is being brought to you, who is aged 2 weeks. So this is we are still in 2 months to 5 years. We haven't yet started 2 weeks to 2 months. So a child aged 2 months to 5 years. This is the question asked: does the child have an ear problem? So if the child has an ear problem, the mother will answer to say yes, and this is done under your assessment. So remember the principles or the flow, how we're trying to do this. So management flow, we're trying to do assessment. After assessment, you need to classify. Under classification, we are looking at diagnosis. You're writing the diagnosis. Then after you write the diagnosis, then you know what to do in terms of treatment. So the third heading should be treatment. Then the fourth heading should be counseling. That's if the child is not referred to the hospital. Then the last one should be follow-up. That's what we agreed. Okay, so if it's an emergency, we are referring to the hospital. You're not supposed to write counseling and follow-up because you have referred to the hospital. So the assessment, I said that it's part of where you do history taking and physical examination. There are 2 things you do: history and physical. Under history, you just ask questions. Then under physical, just look and feel. That's what we mean by assessment. So under assessment, the first thing you do is history taking, which you say ask. So you need to ask, does the child have an ear problem? If yes, then you're going to proceed by saying, is there pain? Okay, or is there ear pain? Then the mother will respond to say, yes, there is ear pain, because that will be guided by the stem of the question. They'll ask you, it's okay, the child has an ear problem and that there is pain, so you need just to confirm to say there is pain. Okay, so if there is pain, the next question would be, is there any discharge or ear discharge? That would be the third question. The first one was, is there an ear problem? Then the mother will say yes. Second question is there pain? Third question is there ear discharge? So the mother will be able to respond to say there is ear discharge. So even in your essay, you'll be able to write like that. You should be able to write to say, okay, there is an ear problem, yes. Then the mother said that the child is experiencing ear pain. Then the third question which you ask is there ear discharge? Then the mother will respond to say yes, there is ear discharge, if there is. Then after that, you're going to say, for how long has a child been having an ear problem? Then the mother will give you, maybe it's 3 days. You have to follow the stem of the question. They might say 3 days. So you also say the mother said 3 years, or 3 days, sorry. So you can just write according to the response. Then what you're going to do is that after history taking, which is this part here, you go now to physical examination, which you're going to say look and feel. So this would be another heading under your assessment. So this is your assessment. Then under this, meaning physical, you just have to look. It's you to look now for pus draining from the ears. So you're going to say that I will check if there is any pus draining from the ears, so that certain if there is any discharge. So you just have to check. Then also the second one you're going to do is you're going to feel, meaning you palpate. Okay, that is you palpate for tender swelling behind the ear. So you're trying to just go to the mastoid bone there. That's why you palpate. and I'll show you where the mastoid bone is. So this is part of your assessment. This is what you write under assessment. So after assessing, they'll give you a response, or even the stem of the question will guide you to say the child has an ear discharge. Okay, they'll just write, say the child has an ear discharge, or the child has a ear pain. So meaning that that's what you're going to follow when writing there. So this is what you're going to put. So you're going to circle that and say maybe the child has an ear discharge or has an ear pain. So meaning that that's what you're going to write under your essay, and then you're going to find that it will be easy for you to even come up with the diagnosis. Okay, so let's just take a look at the images. If you look at the images here, this is ear discharge. Okay, there what I've circled, it's ear discharge here, and then here this is behind the ear. As you can see, it is swollen and it's reddish in color. So this means that the mastoid bone is inflamed. Okay, so we'll talk about that. So that's swelling behind the ear. So that's what you should be able to assess in your assessment. Okay, then you come to the, now maybe the flow chart. Okay, so the flow chart, what you need to do is that since we've discussed what you need to write, so in your assessment, if you discover that there is a swelling behind the ear, this is in red. So if there is a swelling behind the ear under assessment, then in your classification, which is here, meaning you write another heading in narrative form, say classification, like you're writing an essay, not like this in a table format. So you'll be able to write classification. Then you're going to say it's mastoiditis because there's a swelling behind the ear. Obviously, you've seen above here, there is this swelling. So if there's any swelling behind the ear, you're going to say this is mastoiditis. That will be your classification. Okay, in short, your diagnosis, but you write classification. That's under IMCI. So if you write like that, meaning that you're going to say I've classified baby so-and-so under to have mastoiditis because he has a swelling behind the ear. That would be the rationale for classifying under mastoiditis. Then since it's mastoiditis, it becomes an emergence. So what you do is just give first dose of an appropriate antibiotic, which we agreed to say it should be amoxicillin. At least give maybe 25 to 50 milligrams per kg body weight. Okay, that's what you do. So give the first dose. Then after that, since there's a swelling there or inflammation, give paracetamol. Okay, that's 15 to 25 milligrams per kg body weight. That's what you give there, so that at least you will reduce the pain. Then what you do, the third thing is to refer the baby urgently to the hospital. So this is the treatment. So that's what you're going to write under the heading treatment in narrative form, like an essay format. That's what you do or write according to what you've been guided. Okay. Then the second part of the scenario is whereby there is no swelling behind the ear. Okay, but there is pus discharge or draining from the ear, and it's been reported, the discharge has been reported that it's less than 14 days, or there's ear pain. What do? So this is the discharge in another image. So if there's this discharge, as you can see, and then there's ear pain, which is there, as well as discharge less than 14 days, meaning that since it's less than 14 days, we call it acute. So what you're going to do is that since these questions you were asking under your assessment, they've told you that there's ear discharge, and remember that part where you were asking for how long has that been this discharge. So that's why you get this, say, the mother will tell you if it's 3 days or 4 days, but at least it should be less than 14 days for you to say, under your classification, to say it's acute. So if it's less than 14 days, the ear discharge, meaning it's acute ear infection. So that will be your classification or your diagnosis. And you're going to write to say that I have classified baby Chite to have acute ear infection because he's having ear discharge for less than 14 days. That's the rationale for classifying under acute ear infection. And then another heading that follows now should be treatment. So treatment has to be an antibiotic for 14 days, and these antibiotics will give you a guide, other antibiotics that you give apart from amoxicillin. So it will give you the quinolones that you're going to give and what other drugs that you give, okay? So I'll give you below so that you know the drugs to give here. Then you can also give paracetamol for pain. Then you can also advise an earwig. So an earwig will make something, okay, I'll show you something soft so that you wipe off the pus. As you can see, there is pus there, so there should be something to wipe off the pus there. So you have to push it in a little bit to wipe off the pus. That's an earwig. So I'm going to show you what you do for wicking there. Okay, then you have to give them a follow-up, which is maybe in this case you're going to say counseling, what they should do to clean up the ear. After that, you give them another heading to say follow-up. So follow-up should be after 5 days. So this is what you write under treatment. So this there's another stage where you say there's pus scene or pus drainage. Now this pus is 14 days or more, so meaning that this is not acute. Okay, 14 days or more. So this part where this is why you say now this is chronic ear infection, because the duration is 14 days or more. And then under your classification you write to say baby Chite has been classified to have chronic ear infection because the ear discharge is more than 14 days. That's what you do. Then what do you do? Use a dry wick or dry wicking, meaning cleaning the ear, okay, with topical quinolone. We're going to show you the quinolones, okay, at least topical quinolone ear drops for 14 days. That's what we're going to do. Then you're going to provide counseling and follow up for 5 days. That's what happens here. Then what about in green? What happens? So in green, when during your assessment there is no ear pain, no pus discharge seen. So then what you're going to do, the mother was saying the child has an ear problem, but then you can't see, there's no pain, you can't see any pus draining. What do? You're going to conclude to say that there is no ear infection under your classification. That's under your classification. You're going to write classification, then put no ear infection. Then what should be under treatment heading? There will be no treatment. You're not going to give anything because there is no problem. Okay, that's what you do. So this is how we classify these things. So I'm going to follow from the first introduction so that you catch up nicely and you see what we've been doing. Then what about these, the ones I promised? So you are going to look at this, the quinolone eardrops, such as ciprofloxacin, norfloxacin, or fluoxacin. So these are the quinolones that we provide. Okay, so these, any of these can be used. So this is what we do. Then apart about ear wicking. So this is wicking. So wicking, we're looking at this. Okay, so this is how you make it, something soft from a cloth or something that can be suitable, something soft. Then you can do the wicking, which is here. Okay, as you can see, the provider is providing or doing the wicking there. So this is what you do. Okay, so this is what we have under ear problem. So what you do is that you have to go back to the first or introduction, so that at least you revise properly and check the NMCZ questions so that you're able to answer and see what you can do with these IMCI issues. So they're very good. Apart from being used in an exam, you can also apply them while you're working at that clinic. So you've been with Mr. Coco. Thank you very much for listening, and do practice. Thank you very much.